everybody. As you can see, when I went out the door, Fran handed this to me. We are celebrating the return of baseball today, and the Indians and the Reds both will be playing tomorrow night. Look forward to that. I'm wearing a tie from Malone University in Canton. It's home to 1,600 undergraduate and graduate students. Notable alums include former member of the Ohio House of Representatives, Christina Hagan, as well as Josh Eck, Lieutenant Governor's Communications Director. I want to say happy birthday to my brother-in-law, Ken Struing. I've known Ken almost his entire life. He's a master home builder, served in Vietnam. I was a CB in Vietnam, father and grandfather. So Ken, happy birthday. Since Speaker Householder's arrest several days ago, like all Ohioans and certainly members of the legislature, I've been thinking a lot about this and frankly kind of struggling to process everything. So I want to share some additional thoughts before we get started here this afternoon. To my friends in the Ohio House, it's very, very important, I believe, for you to be very engaged at this point in thinking about who the next speaker should be. Obviously, for a speaker to be elected, they have to have a majority of the votes. And I know that this is a process. So I would urge the members of the legislature to do what I know they're already doing, and that is to think about this, start talking among themselves, because it is clear, as I indicated yesterday, that Speaker Householder could no longer function as Speaker with this very, very serious charges from the U.S. Attorney's Office and from the FBI. So the people's business must be done. And so I'd urge my friends in the legislature to very vigorously look at that and try to move as quickly as they can. I want to also talk about nuclear energy policy in Ohio. As I stated yesterday, reasonable people can disagree about what that policy should be. I made it very clear, I've made it very clear for a long time that I think our energy policy in the state of Ohio must include nuclear energy. That the plants that are here that are functioning should continue to function. We have a lot of jobs, 1,500, I think, jobs at stake. But we also have what's really also at stake is the ability of Ohio to maintain much carbon-free energy and cleaner energy. So I think the policy is clear to me, although I know that reasonable people can certainly disagree about that. However, it is also clear, as I think about this, that no matter how good this policy is, the process by which this bill was passed is simply not acceptable. That process, I believe, has forever tainted the bill and now the law itself. This policy, while the policy, in my opinion, is good, the process by which it was created stinks. It's terrible. It's not acceptable. Therefore, I believe the policy, this whole policy issue must be revisited by the General Assembly. I asked the legislature to repeal and replace House Bill 6 through a process, an open process that the public can have full confidence in. I believe that's important, that these two go hand in hand, so that the nuclear power plants can be preserved, those jobs can be preserved, the environmental benefits can be maintained. But the most important thing is that the public have confidence in the process. And it will forever be impossible for the public to have confidence in that policy, in those what's happened, what we've passed, what the legislature passed, voted on, without revisiting it. And so I asked the legislature to revisit this. My preference certainly would be to revisit it, go through that normal process, and come back with an alternative. But this, again, is something that needs to happen in the open, and it needs to happen fairly quickly. In fact, very quickly. Oh, John, do you have something else you wanted to add with that? We'll get our data up here, Eric, if you want to put the data up.
I agree, Governor. No policy is bigger than public trust, and public trust was violated. There are plenty of good things in the bill. I checked with the PUCO this morning about the fact that it would lower prices for customers, that it maintained an adequate supply of in-state produced energy so that we wouldn't have to rely on out-of-state produced energy and the volatility of price and availability that goes with it. So there are a lot of good things in the legislation, but the process just undermines public trust, and you can't have a law on the books that was done in a way that the public can't trust the process. And so it has to be done the right way with public consideration in mind. And I appreciate, Governor, you're asking the legislature to do that, and I join you in encouraging them to do so.
Okay, let's go to today's data. As you can see, the key indicators, again, our numbers as far as cases, 1,444 remains high, higher than the 21-day average. Our deaths, tragically, 21 deaths that have been reported in the last 24 hours. Hospitalizations are up a little bit from the 21-day average, and we're seeing ICU admissions that are about the same or down one. Again, we don't like to see those numbers that high. We would hope that in some areas of the state, and we'll talk about this in a minute, we hope we're starting to see a plateau, but in other areas we clearly are not. Okay, let's go to the new map. Again, this is compilation that was done by our data team, and so this is the new map. And let me give you some of the highlights. And let me just start, though, by kind of reminding all of us that the purpose of this map is to inform people in the county of what is going on and what they should be concerned about. These are indicators. It's like a warning. It is like a alarm that's going off that says, hey, this is where your county is. The trend lines are not going in the right direction. There's grave concern. And so we start, of course, with the yellow and then move to the orange and then we move to the red. Let me start with Allen County. Allen County, northwestern part of the state. We are now moving them from just red to red with an alert. If you look at the numbers, and one of the numbers that we keep looking at, and I always have to kind of hesitate to state it correctly, but we look at 2 weeks, how many cases in the last 2 weeks, and then that is figured per 100,000, so that you're comparing apples to apples, a small county versus a large county, but per 100,000 residents. Allen County is at 107, 107 and a half actually, cases in the last 2 weeks per 100,000 residents. So they moved to the watch list this week. They met 6 indicators. That's the first time they're to 6. The trend is concerning in part because during the past 14 days, 110 coronavirus cases have been identified, which represents 23% of the county's total number of cases since the beginning of the pandemic. So basically almost a quarter within that period of time. within the last 2 weeks. They've seen increases in numbers of people seeking medical care for the coronavirus from their doctors, and also the numbers of people going to emergency rooms for that complaint have gone up. Between July 1 and July 17th, average outpatient visits grew from 5 to 14 visits on an average per day. In Allen County, family and friends taking group trips to hot spots in other states have increased the spread there. One trip resulted in 15 cases that health officials now know about. Friends and family pool parties have also contributed to the county's increasing numbers. County health officials are working very hard to contain the virus, but I would say to my friends in Allen County, they really, really need your help. In every county, we need you to work with your local health officials. Please remember that these health department teams are working tirelessly to keep people in their communities safe and healthy. So when they contact you, please cooperate. Give them the information that they need. We now have 8 new counties that are moving to red today. We'll start in a county directly north of where I live, Clark County. Clark County, and I'll give these numbers at the beginning of each county, 84 cases per 100,000 residents in the past 2 weeks. This is the first week that Clark County is being designated as a red or level 3 county. They meet 4 of the indicators. During the past 14 days, 113 coronavirus cases have been identified, which represents 12% of the total number of cases since the beginning of the pandemic. Between July 1st, Clark County's average daily cases increased from 5.5 cases to 12 cases by July 16th. So if you go from July 1, July 16th, their average daily cases increased from 5.5 to 12. Some of the outbreaks in Clark County are linked to youth sports, also long-term care facilities. One faith-based outbreak had 19 cases associated with it. Now, let me turn to the next county. Let's turn to Defiance County. Again, in the northern part of the state, they are at now almost 79 cases per 100,000 residents in the last 2 weeks. Again, that's one of the ways we're looking at this. During the past 2 weeks, Defiance County has seen 30 cases, which is a higher number than any other 2-week period they've had. In fact, over 1/3 of the total cases for the entire pandemic have occurred for that county in the last 2 weeks. In addition to the increase in cases, the county is also seeing a steady increase in the number of people visiting their doctors for coronavirus. Recent outbreaks in the area have included a workplace setting and social gatherings held in a popular recreation area. Erie County. 119, almost 120 cases per 100,000 residents in the last 2 weeks. Erie County met 5 indicators this week, and local health officials are concerned with the uptick in cases that they are seeing. In just 2 weeks, 89 new cases, or 23% of the total number of cases during this entire pandemic, have now been reported, making the county a high incidence county as defined by the CDC. And remember, if it's over 100, and they're at 119 per 100,000 residents in the last 2 weeks. If you're over 100, then you're a high incidence county. A recent increase in visits to the emergency department also is very concerning. Many cases have been linked to the Ohio Veterans Home, which has an ongoing outbreak. Erie County has also been impacted, as have other counties in the area, by the recent outbreaks from Put-in-Bay. Let's turn to Hardin County. Hardin County is at 51 cases per 100,000 residents in the last 2 weeks. This is the first week that Hardin County is being designated at a risk level 3, red. Hardin County is also seeing an increase in the number of people seeking medical care for coronavirus. From July 10 to July 17th, visits to outpatient settings grew from an average of 3 visits per day to nearly 7. In recent weeks, almost all of the cases were in the community, not in congregate settings. Henry County. Henry County is at 159 cases per 100,000 residents in the last 2 weeks. Henry County has met 4 indicators and is being designated risk level 3. During the past 2 weeks, they have seen over half of their cases during the entire pandemic. The county exceeds the high incident category by quite a bit, as defined by the CDC. Many of these cases have been traced back to a Name That Tune event at a local winery, which occurred on July 11th. That has resulted so far in 53 cases, 53 related cases to that outbreak that occurred when people gathered together at the winery. It is believed that the number associated with this event may also continue to grow. Let's go down south to Lawrence County. They're at 124 cases per 100,000 residents in the last 2 weeks. Lawrence County is moving into red today. During the past 14 days, 74 cases have been identified in Lawrence County, which represents 46% of the total cases since the beginning of the pandemic. Almost half have occurred in the last 2 weeks. The county exceeds the high incident county rate for coronavirus as defined by the CDC. Between July 1 and July 14th, the average daily cases increased from 1 to nearly 8. Some of the county's cases can be traced back to a bar, some to a bus trip, some as well to a funeral. Let's go back to central Ohio with Marion County. Marion County, they are now at 87.6 cases per 100,000 in the past 2 weeks. Marion has had 57 coronavirus cases identified during the past 2 weeks, which represents about 15% of their total cases since the beginning of the pandemic. Recent outbreaks have included multiple cases associated with children's sleepover parties, as well as a nursing facility outbreak. Let's go up to Medina. They are at 61.8 cases per 100,000 residents. Medina County is now is red alert 3 after being at the orange level for the last 3 weeks. According to health officials, Medina County saw 74 cases during the 7-day period of July 6th to the 13th, which is the highest number of cases for a 7-day period since the pandemic began for them. Officials say that the surge in cases did not come from congregate living areas, such as nursing homes or from testing events, but have been traced to graduation parties, weddings, other group gatherings, and out-of-state travel. Additionally, some cases can be linked to Put-in-Bay as well as the Athens County outbreaks, where people went to socialize and then returned home and spread the virus. We have 2 counties this week that, despite meeting fewer indicators, remain red counties due to the fact that they exceed the CDC guidelines for high incidence of COVID. And they exceed it by, as you'll see, with quite a bit. Franklin County has had more than 225 cases per 100,000 residents over the past 2 weeks. Licking County has had more than 110 cases per 100,000 residents over the same period of time. Additionally, we have 4 counties where the spread of the virus is not increasing as fast as it once was, leading these previously red counties to be orange this week. And again, as you'll continue to see throughout this, it is the rate of increase that we look at, how fast it is moving. These counties that change now to orange, Butler, Lorain, Summit, and Wood counties. Butler, Lorain, Summit, and Wood counties. However, all 4 of these, and I would just say all 4 of these are pretty close. They remain close to the CDC definition of where you have a significant problem. For example, all of them are at the moderately high incidence, according to the CDC. But 2 almost hit the definition of high, and if they would have, then they would have stayed red. Wood County had 99.4, so they are literally right on the line between the red and the orange. Butler County is right on the line, too. They're at 97.88 cases per 100,000 residents over the same period of time. So they move forward. They They slipped down, which is a good thing, from the red to the orange, but they're still hovering very, very close to this. I think what this tells us is that overall the measures that we've been focusing on to mitigate COVID-19 spread in the red counties, increased diligence in social distancing, wearing masks, washing hands frequently, reducing interactions with others outside your household, may be helping to slow the increase in these counties. Again, we've got to wait, but we think that that is certainly the mask wearing is helping in those counties because we've seen that go up. We are cautious about this, though. These are still high levels of spread. Citizens across Ohio and these counties really need to continue to be vigilant in following the layers of protection that we continue to talk about. We've talked a lot about long-term care facility outbreaks during this pandemic because this is where many of our most vulnerable people live. I want to tell you about a case that we learned about that is particularly troubling. And we talk about these cases because I think, for me at least, it's instructive about what's going on out there and where our problems are. 2 young women traveled out of state to Texas. They became sick after driving back together. They did not isolate when they came back because there were no orders requiring them to do so, and they did not voluntarily do that. One of the women had a headache but went to work in a nursing home after she got back. She tested positive later for coronavirus, but it was then too late. There are 30 cases in that nursing home. So this is, again, it's instructive, and we're not trying to put blame on people, but we're trying to illustrate how these occur and why it is important when people have symptoms, when they think there may be a problem, for them to be very, very, very careful. And again, we know what works. If they had returned from a high-risk location, started feeling sick after they got back, and if they had isolated themselves as soon as they got back, they could have stopped the spread of the virus. Let me also mention a few other things that we have learned in the last several days. One county told us this week that they have 7 outbreaks, but they all have small numbers that are tied to them. So again, showing a lot of community spread. In a county, in this case a county with hundreds of cases, these outbreaks each had 3 to 12 cases associated with them. Another county said that what they're seeing is a lot of family spread. One member of the family gets the virus, then passes it on and infects the rest of the family. If the first person to bring it into the family doesn't have symptoms, they probably are going to go on with their daily lives, going to work or playing with friends. It's not till someone in the family gets sick that they are tested, and then they start the isolation or the quarantine. John, we'll turn it over to you.
Great. Thanks, Governor. Good afternoon. First of all, a little follow-up from yesterday's conversation on antibody testing. Antibodies as a sign that you may have already contracted COVID-19. On June the 15th, the Red Cross announced an initiative to test all blood and platelet donors for COVID-19 antibodies, and this week we received that report that I alluded to yesterday. Between June 15th and July 18th, the Red Cross reported 33,538 Ohioans donated blood, plasma, or platelets, and I guess we say thank you to them, the people who are our blood donors in this state. Of those, 436 donors tested positive for COVID-19 antibodies. That's a 1.3% positivity rate. The Red Cross reported that nationwide the positivity rate among donors was 1.4%. So Ohio statistically below, but pretty much right in line with the national average. It's important to remember that this Red Cross data does not represent all parts of the state equally. For example, Cincinnati and Dayton The Dayton areas are served by 2 independent blood banks. It's also important to note that during that same time period, hospitals and private labs performed 37,803 antibody tests for Ohioans with 1,624 positives. That equates to a 3.4% positivity rate, which is higher than the Red Cross sample. But these individuals sought out antibody testing, so they sort of self-selected and may have done so because they suspected that they may have had COVID-19 at some point. So I know we've been discussing these issues and the relevance to how many people may have already had COVID-19. These statistics from these 2 sources, I think, shed some light on what the facts are as it relates to antibody tests. Let me move on now to broadband. As we know, what we discuss here every day that we're with you, and the days even that we are aggressively in this state. The citizens, the businesses, the public servants are trying to work with the people of the state of Ohio to control the spread of coronavirus. And one of the reasons that we do that is because we want to be able to do the things that are important. And one of those important things is going back to school. I know that my daughters are excited about the prospect of going back to school in person this fall. And I know a lot of kids across the state, and especially parents, are looking forward to that as well. But we also know that there are some children who, for health reasons, may not be going back, that there's a volatility to this virus that may force some schools to go part-time distance, part-time in person, or in some cases, if the virus were to spread, that they wouldn't go to school in person at all. We know that the ability to deliver education to many of these students, particularly children who come from low-income backgrounds and families, is extremely difficult. That both access, meaning whether they live in a place where they have access to high-speed internet, or affordability to many of those children are inhibitors for their educational opportunities. And so we have been working on this issue. I know that many of you are aware of students who end up in library parking lots to do their homework, or many kids who are trying to gain access through the Wi-Fi that the local school may be providing through buses. So these are stopgap measures, but they certainly don't provide the access that is needed. And we know also that to participate in the modern economy, the modern education system, the modern healthcare system, you need to have this access. And we have to make our best effort available to provide distance learning during this health crisis. And we want these children to get an education. We want to be prepared for the future. We want to support schools who are trying to do that. So what we've done is, in combination with Broadband Ohio and in collaboration with Innovate Ohio, we have worked on this issue to provide support for public-private collaboration, requires state and local buy-in, and values community involvement. And we are glad that we have a partnership with the legislature to expand broadband as well, and we appreciate their support. And we want to announce a few next steps today. So one will be an RFI, a request for information for school districts that have been trying to make these rapid decisions about technology and do it in many cases without the benefit of all the information that they need. We know that they're not experts. We know that each school district trying to find out this information on their own can be cumbersome, and they may not get the best deal. We are working with these schools to identify a centralized location where they can find pricing information, purchase hotspots, equipment to help provide internet for students at home. And so in response to that need, we are issuing the request for information through Innovate Ohio and Broadband Ohio, the Department of Administrative Services and Department of Education, to get these price requests from internet providers for hotspots, laptops, and tablets. We want the schools to get the best deal, and we want them to find an easy place to go do that. And so we are working to establish this RFI, working with the K through 12 schools so that they'll have a single place to find this information. Once we get those responses, they will be immediately posted and we expect them very soon. We'll post them as soon as we get them. And this will be on the state procurement website, procure.ohio.gov. I know that on our Twitter feed and the governor's Twitter feed and social media, we will be posting that as well. But the bottom line is there's going to be a central site where schools can get the information that they need to get the best deal, the best affordable deal on the technology and the accessibility that they need to serve their students. And to enhance their ability to do that, we're also announcing matching grants that the schools will be able to use as they're purchasing these services. We are setting aside $50 million, which is pending an upcoming controlling board approval, so we need the legislature's help with this. I spoke with Senate President Obhoff yesterday, appreciated his thoughtful support of what we're trying to do to get CARES Act dollars for these hotspots and internet devices to enable students to get the access that they need. What we will do is we will match dollar for dollar what they are spending on in-need students, students that can't afford these services. The two programs working together will enable districts to purchase the technology that they need to make sure that students who need to distance learn will be able to do that this upcoming school year. And finally, we are putting forth an e-permitting system for Innovate Ohio is working with ODOT to put an e-permitting system on right-of-way access so that we can get more broadband in the ground, fiber in the ground, get that process moving so that we can expand internet services in this state, high-speed internet services. It's expected that the e-permitting system will save people, the businesses that do this, 24,000 hours of labor a year. That's the bottom line. Saving people time, saves people money, makes it easier, makes it more likely it's going to happen so that we can expand broadband fiber in this state. And the e-permitting system is now available at transportation.ohio.gov/permits. The bottom line through this COVID crisis we have been dealing with is connectivity problems. What we're announcing today are 3 steps to help, first of all, the students, secondly, the schools and those families who are most in need. And we're also building an efficient process to expand broadband across the state. We wanted to make sure that we got that out there as soon as possible so that schools and communities can begin to take advantage of it. Governor?
John, that's great. That's so very, very important. John, I've been talking about that for some time, and a lot of this comes from what we've learned from talking to school officials, superintendents, and others around the state. We talk a lot about, we give examples of where things go wrong, but the vast majority of Ohioans are doing just a phenomenal job in fighting this virus, and we continue to learn. But I just want to cite 2 examples. Yesterday we heard from Jill Parker of South Vienna. What we didn't cover in there really in as much detail is that Jill's 4th of July gathering had, I think, 14 people in attendance. Of those, 11 got sick. So you had another 3. And guess what they did? They went ahead and quarantined. They were taking no chances. They were looking out for other people. They didn't want to carry that illness to anyone else, and so they voluntarily quarantined. So we salute them for doing that. Another example comes from Erie County. A young man working at Put-in-Bay came home from the island because he wasn't feeling well. Didn't get tested, but about a week later on July 10th, his father, who is a football coach at a local high school, tested positive for the virus. Fortunately, the dad was very strict about social distancing, was very, very careful. There was no further transmission of the virus to coaches or athletes or to anyone else. And none of the people in the football program had to be quarantined. So, Coach, thank you for doing that. Thank you for taking care of business. I want to turn now, before we go to questions, one last thing and turn to bars. The Ohio Investigative Unit is the unit that goes out and checks on bars. This is what they do. This is what they did before the coronavirus. They continue to do that. And one of the things that they pride themselves on doing is education. They try to work before citing someone. They try to help them share ideas that they have seen in other bars, particularly during this coronavirus when the distancing is so very, very important. We have had outbreaks, we know, that have come from bars, Cleveland, Columbus, Toledo, Athens, Henry County, Lawrence County, Medina, Sandusky. But the vast majority of the folks who are out there running bars are doing a good job. And the reason we know is these are the reports that we get back from the agents. And so we have one of our OIU agents today, OIU agent in charge, Michelle Turo. Agent, thank you for joining us. We appreciate it very, very much. And I wonder if you could just, well, first tell us how long have you been with the agency? How long have you been doing this?
Good afternoon, Governor. I'm proud to say I've been with the High Investigative Unit for over 16 years now.
Well, that's great. We've got a new challenge you've had in the last few months with the coronavirus, certainly not something that any of us were used to dealing with. Can you kind of tell us what you're seeing and what the men and women who work with you and for you are seeing out there as they go into the different bars and check things out?
Well, what I'm happy to report, sir, is that we're seeing a large number of compliance. We've had the opportunity to speak with permit holders. We've had a lot of conversations about education and working together to make sure compliance is happening. And they've really come up with some best practices. And we've had the opportunity to speak to them, share with other permit holders, and really see a wonderful effort by so many businesses here to comply with the Division of Health orders.
That's great. That's always great news. I know that's what you've been transmitting to me and to our team. You also have, unfortunately, some outliers who are not doing a good job, and I wonder if you could just kind of tell us what you see when you walk into a bar that's not doing a good job.
Yes, sir. Unfortunately, we have seen that. And what's occurring and what our agents are seeing is patrons are shoulder to shoulder. There's absolutely no attempt to follow the Division of Health orders. There's no mask wearing by employees. There's absolutely no social distancing. People are congregating in large numbers. People are pretty much running their businesses like they would have in February, unfortunately, and that's when the violation notices will be issued.
And I believe that the first cases you have, for the ones that you've done, are in fact coming up, I think, in August, early August. Is that right?
Yes, sir. The first case is to be heard in front of the Liquor Control Commission will be August 3rd through the 7th.
Okay. And you want to tell us a little bit, how many cases you've had? How many cases, if you recall, did you all have last weekend?
Well, we had approximately, I say approximately because one permit premise was actually issued 2 citations 2 days in a row. Oh. So we had 10 permit premises who were issued for 11 violation notices.
Okay. And my understanding is that you, at least last weekend and maybe before, but we're basing a lot of these stops based on tips that you might have had or information before you went in.
Yes, we've had a wonderful partnership with the local division of Department of Health as well as our law enforcement partners. And we've been directed a lot by complaints that they're receiving as well as complaints that we're receiving from community members who are concerned about making sure that public safety is followed in all bases of restaurants, bars, and dance clubs.
Great. Well, thank you very much. Thank you for the work that you do, and the men and women who work with you. We appreciate it very much and appreciate your career and your career in public service.
Thank you, sir, so much for having me. And if I may, just remind everyone that the Department of Health and the Ohio Investigative Unit is here to work with you. And we'd love to have the opportunity to talk to make sure that you can follow the Division of Health orders. And if you could just call us, and we want to talk to you on a Tuesday afternoon instead of a Friday night.
Thank you. We appreciate it.
Thank you, sir. Have a
great
wonderful day.
Thank you very much. We're ready to go to questions.
Hi, good afternoon, Governor. Jeremy Pelzer at Cleveland.com. Want to see if you could go into more detail, lay out the factors that led to your reversal on calling for the repeal of House Bill 6. In addition, how much of your decision specifically had to do with the news about legislative liaison Dan McCarthy? Can you hear me? Uh-oh. Take two, Governor. So it's Jeremy Pelzer, Cleveland.com. Can you hear me? Uh-oh.
Hold on. Sure. Try now.
Hi, Governor. Can you hear me? Hello?
Sorry about that. Now we're in business, I think.
Technical difficulties. Well, yeah, so it's Jeremy Pelzer, Cleveland.com. Wanda, could you lay out the factors that led you to change your mind about House Bill 6 since yesterday? And in addition, how much of your decision specifically had to do with the news about your legislative liaison, Dan McCarthy, being named, about the news being about him being the former head of a nonprofit that was listed as a pass-through entity used by First Energy to fund householders' alleged bribery scheme? Thank you.
Well, first, let me start with Dan McCarthy. Dan McCarthy is someone who has done an excellent job for the people of the state of Ohio since we took office. He's our legislative director. He had a long career before that, but he's done a phenomenal job. Neither Dan nor anyone else that I'm aware of in my administration has been contacted by the FBI or contacted by the Justice Department, and I think that was pretty much confirmed by the Justice Department the other day in the press conference. So we have a great deal of confidence in him, and have no indication at all that he did anything wrong at all. As I said, this hit all of us, I think, out of the blue. I mean, I found out when everybody else found out that morning that the speaker was being arrested. And it takes a while to process what this means. And so, I've not changed my position in any way in regard to the merits of the policy. I think the policy, to me, is clear. We got 1,500 jobs at least at stake. This is the only way we're going to be able, in the immediate future at least, to be able to have much of any non-carbon energy production in the state of Ohio. We've always said, both Lieutenant Governor and I have always said that we need a balanced program in the state of Ohio, balanced energy. Nuclear, certainly for the rest of the life of these two plants, should remain a part of that. It was also a bill that was going to would cut down on what the average person was going to pay. So I thought it was good policy, good nuclear policy. But as I've thought about this and just kind of let the whole story sink in, and it takes a while to really get it, I guess. It was clear to me that this policy, however good I think it is going to be forever tainted. And the only way I know to go back is literally to do that, is to repeal the bill and have the legislature take a look at this issue and come up with a substitute bill, something that this legislature will work its will on. So you have to reverse the process and go back. And I made that decision, frankly, because while the policy I still think is very good, what we found out the other day will forever, in the public's mind, taint that policy. It will forever taint the way we deal with nuclear energy in Ohio. It will forever taint those decisions that were made. So I don't know any way of backing it out other than to have the legislature repeal it. At the same time, what I would ask them to do is come up with an alternative. Again, we'll see what the legislature wants to do, but that's why I came to that conclusion. It's a matter of public trust, and whether this is good policy or bad policy, I think it's good policy. But whether it's good policy or bad policy, the most important thing that exists is public trust. Public trust has to have been monumentally shaken by the revelations about Speaker Householder. That is not good for this state. If you recall, the first thing I said about this was the statement I put out, it's a sad day for Ohio. It was a sad day for Ohio. It's a tragic day for Ohio. We have to regain the public's trust. And the only way to do that I know of in regard to this particular policy matter is to go back and repeal it and start again. Is more important than any policy. More important than any policy at all.
Andy Eldridge with Hannah News Service. So I'm sure you've been watching what's going on in Portland, and it looks like Cleveland might be next on the list for federal agents to come in and start to try to crack down on protesters. What kinds of conversations have you had with President Trump about this issue, and do you support federal agents coming in this manner?
Well, I talked today to Mayor Jackson. Mayor Jackson and I talk several times a week, as I do with the other big city mayors around the state. And let me just say, we have a phenomenal relationship, I think. At least I would describe it as phenomenal. We deal with problems. Law enforcement from the Attorney General's office, if they can be of help, from our office, and whatever the issue is, we try to work together. As you know, during the recent the demonstrations, which in a couple times turned into some violence. When I was asked to send in the National Guard, we sent in the National Guard. But we work very, very closely. And so the mayor and I had a discussion. It is my understanding, and I think it's the mayor's understanding as well, that the help that they're going to get is a very different type of help than you saw in Portland. It's not my understanding that we're going to see anything like that in Cleveland. What I think the public needs to understand is when the system works well, the federal government, whether they be DEA agents, whether they be the FBI, any other department, works all the time with the state and works all the time with local officials. That type relationship is healthy. It is very, very good. And to my knowledge, that's what this relationship is going to be in regard to Cleveland and the federal government. It is different than what was seen in Portland. I'm not commenting on Portland. I'm going to stay in my state. But, I think that this is going to be a good relationship. And the mayor and I were talking today, and we'll continue to talk.
Portland, would that be okay in Ohio?
Look, all I know is what's been reported on the news. In Ohio, we have a close working relationship between the state government, governor, and the mayors. We stay in touch. If there's assistance that's needed, we are there to provide that assistance. If it came to a point where we needed federal help in anything, and we always will reach out. We need sometimes ask for help in investigations. I know the Attorney General's office might. Sometimes we will ask for specialists. I know when I was Attorney General, we would ask for specialists to come in from the FBI. It might have been a case that we were investigating, but we would ask the FBI to come in they had a specialty. So that type relationship goes on all the time, and it's not controversial. It's very, very productive. So that's the type of relationship that we have in Ohio. We're very proud of that relationship with the federal government, proud of that relationship for the state with the local community. So, I don't know exactly what happened in Portland. The idea of agents, people coming in, and where there's not the consent of people locally, that would be a problem in Ohio. But I don't think that's going to happen. We have no indication that's going to happen.
Thank you.
Good afternoon, Governor. Marty Schladen, Ohio Capital Journal. On Tuesday, U.S. Attorney DeVillers said that there was no way that the corrupt scheme around House Bill 6 could have been carried out without the use of dark money groups. When the Supreme Court issued its Citizens United decision, it said that disclosure was a key behind corporations spending political money. So, first of all, do you think it was right for Dan McCarthy to run a dark money organization that took all these contributions that were used for political purposes? And should Ohio join other states in passing laws that require disclosures of corporations that are spending money in this way politically?
I don't know all the facts, but I will tell you that organizations like the one that Dan was in charge of or had connection with are very common. They're out there all the time, and they're perfectly legal. There's nothing wrong with them, and they're legal pursuant to Supreme Court decisions. They're legal pursuant to Ohio law. But I will repeat what I said yesterday, and that is, I am for as much disclosure as the United States Supreme Court decisions allow. I'm for as much disclosure as we can have in Ohio that the Supreme Court will allow us. And I know there are viewers out there who, have not navigated these decisions or navigated these different cases or what the law is today. And I do not pretend to be an expert. I'm not a constitutional scholar. But I put that caveat in there because the Supreme Court's decisions have been pretty broad in this area and linking this to First Amendment protection. So whatever the Supreme Court has done, they have done. And until they would overrule a case, that is where we are. So my position is the same as it was yesterday, and that simply is I'm in favor of as much sunlight as we can have that's consistent with what we can constitutionally do.
Thank you, Governor.
Jack Windsor, WMFD TV in Mansfield. Somewhat lengthy question, Governor. I hope you'll beg my pardon here. I want to understand the antibody testing and contact tracing strategy a bit. The Lieutenant Governor just stated that our local Red Cross suggested a 1.3% positivity on blood samples for COVID. Hospitals and private labs are showing 3.4%, so somewhere between 2%. That equals about 234,000 people that have already had COVID. However, the director of the CDC, after 2 antibody studies of 10 states, has twice confirmed that number to be about 10 times the current number of positive cases. So in Ohio, that would be about 800,000 positive cases, which is the number I brought up yesterday. When it was announced in April that we would be hiring 2,000 tracers, it was stated that the number of tracers was based on the case level at the time, 5,000 tests a day and about 20,000 cases. Governor, if 800,000 Ohioans, or even to use your number of 240,000, have already had COVID, the horse is still out of the barn, which is what I said yesterday. Isn't it an impossible strategy to test and contact trace at that level? And if our hospital capacity is not at risk, which yesterday you said it's not, and if death rates continue to plummet, which they are, then the curve is flat. How do we justify any mandates and restrictions on our schools and businesses and now even our personal lives?
I am not as pessimistic as you are on that. No, we certainly can run these cases down. I think every expert in the country who understands tracing and testing says that the two go hand in hand, that we must have both. go after these cases. Whatever number you use, it's still a relatively small number of Ohioans who have had it. A lot of people, but as far as a percentage, those people, there's no reason to believe that most of them are no longer contagious. So I think the better question, the issue is, how many new cases are we getting? Do we have the ability to trace those, go back to each of those individuals and try to cut this virus off at the knees? So no, this is the right thing to do. Virtually every expert, the jury is almost pretty much unanimous on this. Tracing is important. Testing is important. Look, we're not where we want to be. We're about 6.2, 3, 4, 5% positivity of people we're testing in Ohio. We would love to be at 4. We'd even better like to be at 2. But we're not at 20 either. And we've got some states that we listed them up here yesterday, all the ones that were 15. So it certainly is manageable. But one of the lessons that we've learned is that the earlier we can cut this off, the better off we are. And that's why I've said today, and I continue to say, that if you're a yellow county, if you're in Orange County, even more reason to wear a mask, even more reason to try to cut this off, because it's now much more manageable than when it gets out further and further. And if you want to see a problem, if a state is at 20%, that's really rough. So we don't want to get there at all. So I'm confident in what we're doing.
So what is the end goal then? If we flattened the curve and ramped capacity and we were successful at that, what's the end metric that you're going to keep restrictions and lockdowns and masking in place?
Is to keep as many people alive in this state, have fewer deaths as we can, and keep people from getting sick, with the understanding that there are a lot of people out there who are watching this today who got very, very sick, went through hell, and some of them have long-term permanent damages. And in some cases, they don't know what that is. So the goal is keep our economy going, same time, keep these cases down. The simple way you do it, the basic way you do it is test, 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 and trace, trace, trace. And the citizens of Ohio wear a mask and stay away and keep a distance. It's basic. We got to keep doing it, but the end game is clear. The only way that our economy is going to continue to move forward is if we keep the coronavirus down. And we will not get rid of it. It's not going to totally go away, but we can knock it down very, very well if we all continue to do this. That's my commitment, to do that.
Hi, Governor. This is Tara Morgan with ABC 6 News. This is a question regarding policy and order decisions. When it came to masks, you wanted them, and then that decision flipped the next day, only to have a statewide mandate starting today. And then the repeal of House Bill 6, you said you didn't support it yesterday. Today you're recommending a revisit. Can you tell us why these changes of your mind might be coming so quickly? And do you believe whether it's causing any confusion to the people listening in?
Well, let me go through both of these again. We were one of the first states to come out with a mandatory mask order for every employee in the state of Ohio. That was the right thing to do. At the same time, we talked about putting on a mandatory mask for everybody who walked into a business. Part of governing is leading. Part of governing is also leading people who will follow. It was clear that people were not ready to do that at that point, and so we did not do that. But later on, as you saw, we decided to really continue to try to keep people informed by going to a color code, that we then linked that color code to any county that was red. People would have to wear a mask, and so we put that into place. We started seeing some good results, we think, preliminarily at least, with more people wearing masks. And it's not just because they were red counties. A lot of things are going on. People are starting to understand, I think, better the need for a mask. Remember, all the experts at the beginning of this said, don't wear a mask. And so that what we've seen throughout this virus is it's evolving what the knowledge is and what the information is that is coming from the medical community. And so we are at a point now where I think people will accept this. It is the right thing to do. We've been at 60% of the state. Now it's time to move to 100% of the state. In regard to House Bill 6, I've not changed my position. This is the right policy. The policy is right. Keep nuclear energy in the state of Ohio. Keep those jobs there. Very important for those families. You know, those families, by the way, didn't have anything to do with Larry Householder. These are men and women who just go to work every day, and they work hard. And I've talked to a lot of them. I went over and visited one of the plants, and they're just doing their job, and they're doing a good job, and a tough job. So their livelihood is at stake. Their families are at stake. But it's the right policy. But when you look at it, and I think about it, and mull over in my mind, what was in that charging document, you become more disgusted, and it's very understandable. And I haven't taken a survey, and I haven't gone out and talked to a ton of Ohioans, but my instinct is that Ohioans also agree with me that this is repugnant, this is disgusting, and the fact that a bill passed as a result of that type of activity, which was wrong, it's morally wrong. Let somebody else judge the legality of it. You heard what the U.S. Attorney said. But it's wrong. This conduct is wrong. And it forever taints what happened. And so ultimately, the most important thing as we govern, the most important thing in a country like ours, is that people have some faith in public servants, that they have some faith in the process. And when you see a process that has been so perverted that it results, no matter what the result is, it's clear that that's not acceptable. And I think it's not acceptable to the people of Ohio. And the trust of the people of Ohio in the process, in the system, is more important, frankly, than the policy itself.
Thank you.
Hi, Governor DeWine, Dan Perlman with NBC4 here in Columbus. I'm sure you're aware of the reports that Columbus here is among the 11 cities where the White House said aggressive steps should be taken to mitigate COVID-19 outbreaks. Were you on that call with Dr. Deborah Birx, and will you be taking or are you considering new aggressive steps in Columbus to slow the spread of the virus?
Well, I was off and on that call. I'm not sure I was on that part of the call. I may have been. Look, we're working very closely with our two health departments, with the city health department, the county health department, working very closely with Mayor Ginther. We are making every single effort that we can, and we will continue to do that. So, look, the numbers are high in Columbus. They're high for a number of different reasons. We have a younger population in Columbus. It's the youngest city as far as population and age in the state. And we're seeing a significant outbreak in those who are 20 to 29, actually even those 20 to 40. So it should not shock anybody that is what we are seeing in Columbus. But we are focused on it. We always are looking for help. We're always looking for help from the federal government. If they want to help in any way, obviously we want that. I talk frequently to the vice president on these calls with governors. So we'll continue to stay focused on it.
Thank you.
Hello, Governor. This is Luis Gil with Ohio Latino TV. Thank you for the rethinking on the House energy bill, Governor. What will be the consequences for the average person through all this? Will there be, if the bill happened to fail in the future, will there be higher fees, or in the meantime, what does it mean during the investigation for the average person that is a customer of Energy First?
Louis, this is an area where obviously reasonable people can be on both sides of this issue. You can argue this either way. I happen to believe what I have said about the policy. A lot will depend, and let's be optimistic, and let's hope that the legislature would repeal, and let's hope that they would have a good discussion, and that we could find, a place to come out on this that the public would have confidence in. To me, that's the most important thing. Whatever we end up with, that the public can have confidence in it. I think those jobs are important. I think having nuclear energy in the state is important. I think having nuclear energy where it really is the vast majority, 85 to 90% of the carbon-free energy we have in Ohio is nuclear today. So in specific answer to your question, it's going to depend really on what bill you would end up with. But the bill that was passed, one of the arguments in favor of the bill was that for the average customer, their fees would go down because of other changes that were made in that legislation.
Thank you, Governor.
Piece to that, because I did a little refresher this morning and talked to the PUCO to remind me a little bit about what was in the bill that didn't have to do with the nuclear power plants. And one of the things that they reminded me of is that, with a lot of the coal-fired power plants coming offline, there are gas power plants going in place, but Ohio would be somewhat unprotected from the volatility of price and resource without the provisions in the bill that favored in-state production of energy. And I know that there's a concern among some that exist, and probably not during a recession, but after we get out of a recession, that the demand for energy could exceed what is being produced in Ohio. And as a result of that, you make Ohio businesses and consumers susceptible to availability and volatility of price. So there's a lot of things that were in here that are unrelated to nuclear power plants that are important pieces of public policy to be considered as we look at this. But look, as the governor stated, there is no one piece of public policy that's more important than public trust. It's just, that's the bottom line here. But that doesn't mean that we can just say repeal House Bill 6 and all the problems are solved. There's a lot of things that are packed in here that are important to the future of Ohio's energy system. And those have to be thoughtfully considered, and that has to be considered first through the eyes of integrity and public trust.
Thank you, Lieutenant Governor.
Hi, Governor DeWine. This is Farnoosh Mary from the Associated Press. I wanted to talk to you a little bit about what your conversations have been with lawmakers in the past 24 hours about what this repeal should look like, and kind of what the urgency is now, obviously, to help preserve these plants. Is there any expectation that this could get done within this year, given how much opposition?
Well, I think every lawmaker heard what I said the other day, was reported to them. Our team has been talking to different members of the General Assembly. I've talked to several as well. And look, it's taking legislators a while to process this. You just wake up one morning and the world, this whole thing has changed, and you hear this, horrible story. And then it settles in that they need to find a new speaker. So somebody's got to put together 50 votes. They've got to think about who that would be. It's not my job, nor is it proper, frankly, for me to suggest to them who that individual should be. This is a co-equal branch of government. I should not do that. But clearly it needs to be, kind of state the obvious, it needs to be someone who is respected, someone who has trust, and people trust on both sides of the aisle in the sense that they're just a respected, good person. And I'm confident the House will find that individual and that the House will select that individual, and this state will be able to move on.
Thank you.
Hi, Governor. Andy Chow with Ohio Public Radio and Television, State House News Bureau. We've talked a lot about the nuclear bailout side of HB 6, but the bill also rolled back renewable energy standards, eliminated energy efficiency standards. In a repeal and a replace scenario, would you like the legislature to keep those pro-clean energy standards in place?
You know, I think all things would be on the table, Andy. I think, you know, that we should have a debate about all of those issues. I think the legislative process, when it works correctly, is, you know, an essential part of our country and our state. So all those things are certainly open to public debate, and they should be. Everything would be on the table.
Are you at all afraid that the damage has been done?
Can I add to that? When I was Speaker of the House, I created the renewable energy standards. So I was a fan of them then, but they need to obviously be updated to reflect modern times. But remember, those were always about carbon reduction, and the nuclear power plants are 85%, I believe, of all of our carbon-free energy production in Ohio. So it's a huge piece of that zero carbon approach to energy, and it's just important to remember what's the goal here. And why do we have standards, and what are we trying to achieve, and what's the most cost-effective way to do it? That's what the debate should be about.
Thank you.
Good afternoon, Ben Schwartz with WCPO in Cincinnati. Governor DeWine, yesterday you said hospitals are telling you that they're fine. But previously, you have talked about the slow and steady increase of coronavirus cases at hospitals. I'm wondering, at what point are hospitals not okay?
Well, they're the ones that will tell me first, I'll guarantee you that. We have a constant communication with them. You know, one of the reasons we put the 80% indicator in here is that is a factor when you hit 80%. Now, you also, and we talked about, I guess, this a little bit yesterday in another question, but the 80% of capacity does not necessarily take into consideration some of the build-out that they can do. And so when we went through this the first time in March, they were all geared up, and they built out, or they made arrangements for build-outs. So, you know, they have the ability to build out and to move forward. But I will guarantee you that on the document that I get every morning on my iPad, where we look at all the different things, all the different data, hospital capacity and how full these hospitals are, I look at this not by hospital, but I look at it by region. And that's on my briefing paper every single morning. So we look at those. I had, frankly, the other day, I was asking our team about Region 7. I said, how's that looking? So it's something that we monitor, and we'll know. We'll know when we're getting there, and we will tell you. When we start to see a problem, we'll tell you, and everybody will know about that. We'll be very transparent about it.
Thank you.
Afternoon. This is Jessie Balmert with the Inquirer. You talk about the importance of rebuilding public trust after the investigation Tuesday and everything that's happened. Given that so many of the players are going to be the same, how can Ohioans have confidence that the replacement won't have the same problems as the first House Bill 6? How can you build that public trust?
Well, look, there's a huge difference. And again, everybody knew there was money being spent. Everyone around Capitol Square, at least, probably had a pretty good suspicion about where that money was coming from. But no one knew of this, as they labeled it the other day, this enterprise was taking place, or that things illegal were being done. No one knew that. And so what would be different is that wouldn't exist. That would not happen. That's the difference. John, you
look, the primary reason that we're dealing with this, that person won't be there, and that's a huge factor. That, you know, everybody who was part of what the U.S. Attorney identified as the corrupt scheme, they're all going to be gone, and we'll begin the process with the new speaker and a new day, so to speak, with all of this being out in the open. And well, some of the legislators will be the same. I think that the process behind this, because that's what we talked about today, that the policy may be acceptable to the majority, but the process was not. That includes the attempt to thwart the voters' right of referendum, which was a big part of what I read in those 80-some pages, that we all read in those 80-some pages. So those are going to be big differences during a real repeal and replace process.
Good afternoon, Governor. Kevin Landers, WBNS 10 TV, and I am the last question of the day. Dan McCarthy worked by advocating in support of nuclear power for First Energy and also asked lawmakers to support financially as well. And you talked a lot today about the taint associated with HB 6. Are you concerned that his employment would taint your own administration? And secondly, we had a sad story here at Newark Nursing Home where 11 people were dead, 59 residents tested positive, and 32 employees also tested positive. I'm curious to see if you think there needs to be more restrictions or perhaps other orders as it pertains to nursing homes in our state. Thank you.
Well, we've had very restrictive orders, as you know, in regard to nursing homes. But nursing homes across the country, tragically, have been a place where a lot of people sadly have died. The National Guard is completing testing at nursing homes. We are contracting with companies, and we'll announce this next week, exactly what we're going to do, that will call for regular, every 10 days, testing at nursing homes of all staff, because staff is basically how it generally gets into that nursing home. So look, it's very tragic. It's very, very sad. It is something that weighs very heavily on me every single day as we try to do things that will make a difference in those nursing homes. As far as Dan McCarthy, look, Dan McCarthy is someone with a great deal of integrity. Dan McCarthy, there's absolutely no indication that Dan McCarthy was doing anything illegal or anything wrong. Organizations like this are set up all the time. They are perfectly legal. It is what people do with them where the problem appears to be, or the problem is, in regard to what Mr. Householder was doing. So again, as U.S. Attorney was asked the other day, is there any about the two of you all asked questions about does this involve the governor's office? And as I recall, the answer was no. Look, we have an obligation to be transparent and open. These events occurred before Dan even started working, before my administration even started. But we've seen nothing that would indicate that he did anything wrong.
Thank you, Governor.
Thank you, Kevin. We'll go to the end. Yesterday we ended with a video from Cincinnati. Today we take a trip up Route 75 to Toledo to show how that community is being resilient during the pandemic.
Seemingly overnight, our world got so much smaller. Before, we were so focused on bringing the world to us, it ended up pushing us apart. Now all we want is to be able to reach out again and touch one another. So when our world opens back up to us, let's not take it for granted, ever again. Stay strong, Toledo. We're in this together.
Let's hear it for Toledo. That was great. We'll see you all next Tuesday at 2 o'clock, barring some breaking news that occurs before then. Have a good weekend, everybody.